The session 4 is about the clinical rotations in United States. And I would like to introduce the panel of the speakers for session 4. Our first speaker is Dr. Ali Nauman Khan. Dr. Ali Nauman Khan is from the Amiruddin batch A1, and he was the first who go to the United States, and he's currently working as attending physician and assistant professor at Massachusetts, USA. The next panelist is Dr. Muhamad Luqman. He's from the second batch of Amiruddin Medical College. He's also joining us from the United States, and he's ECFMG certified. The third presenter of this presentation is Dr. Muhammad Saad. He's from the fifth batch of Amiruddin Medical College. He is also ECFMG certified, currently doing rotations in United States. And he's also ECFMG certified and joining us from the United States. So over to the next session, clinical rotation, session 4. Thank you so much.
Assalamu alaikum, everyone.
Hi.
Assalamu alaikum, everyone. So I'm Muhamad Luqman from the second batch of Amiruddin Medical College, and I, alongside with my senior Dr. Ali Nauman Khan and Dr. Muhammad Saad, will be discussing about the US clinical experiences. So, beginning with this section, I would like to emphasize on this one statement. Any US clinical experience matters. Because when we start our USMLE journey, even when I started my USMLE journey, or over the years I've talked with my class fellows, my friends from different universities, from different medical schools, and juniors, even my students from UCMD, there's this one notion that if you're rotating in a clinic, you're getting a rotation in a clinic, it doesn't matter much. We shouldn't focus that much, or we should probably divide our energy towards getting rotations in major hospitals or teaching hospitals, etc., etc. But I would like to emphasize on the fact that this is just a myth. Go for any US clinical experience that you can get your hands on, because US clinical experiences matter a lot. Because one, they are your gateway into the healthcare system that you guys are trying to crack into, that we are trying to crack into. And it's a day and night as compared to Pakistan healthcare system. So it is very important to gain US clinical experience before going into match and everything, because it helps, it's one of the crown jewels of your ERAS application. Because over the time that I've been in the US, and even before that, whenever I would get a chance to talk to any program director, any person who was a program director or was a part of the panel who selects candidates to be interviewed in each match cycle, they all emphasis on one thing, and that is US clinical experience. Your USMLE step scores matter, but they matter with the fact that they help you save yourself from the filter that a lot of programs have set for themselves, that we are not going to interview people who have, for say, a USMLE step 1 score below 210 or USMLE step 2 score below 220 or 230. That your USMLE score helps you with that, to pass over that hurdle. But the US clinical experience tells a lot about your passion, your dedication, your enthusiasm, and how much you are focused and directed into your pathway. So saying that, it also helps program directors to choose people who know how the system works, who know how EPIC works, who know how different EMRs work, who know how your healthcare team works, who know how the components such as social workers, PTOT, and everything work together in providing the best patient care to the admitted patient in the program. So they want someone like that rather than a candidate who, I'm quoting the exact same thing that was told to me, that no one wants a headless chicken running around their hospital, not knowing what to do. So the US clinical experiences help us familiarize ourselves with this whole system, with the whole thing, and also help program directors and the selection committee pick out candidates who the deemed are better fit to the program. And also a US clinical experience, a directed US clinical experience for a candidate helps us to better compete with the local graduates. Because once you are a resident, you're no longer an IMG or a local graduate. You are all residents. We all have to perform on the same level. And to perform on the same level, we need to have some prior exposure, because the local graduates are always gonna have advantage for the fact that they are working the same system since day one of the medical school. So it's important that we do as much clinical experiences, as much work, so that we can bring ourselves to the same level as them. And also, last thing, why US clinical experience is very much important is that it helps you drive your narrative for your ERAS application. Because the ERAS application is a screenshot of the entire journey that you have had since getting into medical school and all the way up till this point where you are applying for match. So it should be your clinical experiences should be very focused and directed. For say, if you want to pursue cardiology, your personal statement says that as this significant moment or this significant event ignited this passion for medicine in me, ignited this passion for cardiology in me. But then you go into doing rotations in, say, internal medicine, pulmonology, general surgery, just random rotation just to get clinical experience. That's gonna drive your whole narrative away from cardiology and gonna give an impression of someone who has no idea what they actually wanted to do, who has no direction. So even though I have said that any US clinical experience matters, but it should be directed. Directed in a sense that it should be focused on one clear pathway, such as, for say, if we are taking, I gave you the example of cardiology. It should be like you did one rotation in internal medicine, you did one rotation in cardiology, interventional cardiology, interventional radiology. These are all like a bit of a focused, a bit of a directed approach with your US clinical experiences. So this is the importance of US clinical experiences. It helps you get an overview of the US healthcare system, helps your ERAS application, helps your narrative, helps the program directors identify your passion, your strengths, your capabilities through US clinical experiences. So this is the overall importance of the US clinical experiences, the US rotations. Now I will discuss with you the types of US clinical experiences that are available. So if we can move to the next slide. So we have 4 major types of clinical rotations available: electives, observerships, externships, and then internships and sub-internships. This is where the whole narrative of, okay, aim for an elective, aim for an externship, or aim for an internship comes into play. A lot of people downplay observerships because it's nothing but you shadowing someone. So we can go one by one about the pros and cons and how each type of the rotation differs from the other. So the first one is electives. So the first one is electives, and electives is the most thrown around word when it comes to the USMLE career counseling and everything. But we need to understand that an elective is more or less like your clinical rotation that you do as an undergrad in surgery, surgical unit 1, 2, and 3, gynae unit 1, 2, and 3, medical unit 1, 2, and 3, where you are given a logbook on which you have to perform a certain number of procedures, certain number of physical examinations, and a certain number of patient presentations and all that, and have it signed by your supervisor. And it's the same in electives. And these are for undergrad medical students, and these are hands-on experiences. These are excellent experiences that you can get, and these are advantages from the point of view that a lot of university hospitals, a lot of major residency programs have their official elective applications, the schedules where they can accommodate international graduates or not international graduates, but international students in their program, and they rotate them through. It's a very hands-on experiences, and you get to have a head start with your EAS application and everything. So elective, if you're an undergrad and you know you want to do the USMLEs, then go for electives and start early. Start planning for them in your summer break. And these are excellent hands-on experiences. The second is observership. Observership is mostly for IMGs, which is International Medical Graduate. Which is that it happens once you graduate. And observerships, the reason why people downplay them is that they're either a hit or a miss. They can be a miss for a fact that some physicians only allow you to shadow them, which means that you're just in the shadow, just in the background, observing their daily routine, observing how they are putting in patient notes, and occasionally they will throw in a question at you and you can answer them, and that's the most involved that you can be. But then there are some preceptors out there like that they allow you to interact with patients. They as a matter of fact, they push you into taking patient history, growing through the patient case on Epic. Like they give you access to Epic in the office. You can pick patients, you can go through the whole notes and everything and prepare your case, then go to the patient, talk to them about their problem list, talk to them about how they are perceiving the treatment that has been given to them. And you can even perform physical examination. So observerships can be either just a shadowing opportunity or just even a hands-on experience. And this is for the graduates. Once you have graduate medical schools, you are for observerships. Then the third type is externships. These are basically electives, but for graduates. And these are kind of difficult to get, but you can get them through proper networking if you know the correct people. And even if you go in for an observership, they can vouch for you and they can tell you how you can get a certain externship and all that. With them hands-on experience, it's pretty much excellent. You get to do everything and all that. And last, but the most important and the most sought after clinical experience is an internship or sub-internship. This
अस्सलाम
is prime. Walaikum salam.
लुकमान भाई सॉरी टू डिस्टर्ब यू थोड़ा सा
Yeah.
ऊंचा बोलिएगा इधर वॉइस का इशू आ रहा है माइक थोड़ा करीब कर
अच्छा
लें
वो ठीक है, अभी सही आ रही है आवाज? ठीक है, अब
थोड़ी सी
हमारे
बेहतर है
पास
थोड़ा
चलिए।
और कर लें तो ज्यादा अच्छा हो जाएगा
हाँ चलें, ठीक है। अब जो हमारे पास जो लास्ट क्लिनिकल एक्सपीरियंस की जो टाइप है हमारे पास, वो है इंटर्नशिप्स या सब इंटर्नशिप. This one is the closest one that you can. This experience is the most closest to a PG1, which is like first year residency. Here you have your own patient list, which you can open up in Epic, go through your patients one by one, then go talk to your patients, create your problem list and how you're going to manage each problem and what your notes are going to be like, and then go over them with your attending physician, and then sign them, submit them, and it's basically just like your PG1 rotation. And it can be for 3 months, 6 months, even a year at some programs. This is something that is highly recommended once you have graduated, and this can be done through networking and all the different pathways that we are going to discuss from here on onwards, how to approach US clinical experience, US rotations, and that Dr. Nauman Khan will probably now discuss with you. Over to you, Dr. Ali Nauman.
Hi, can you hear me? Assalamu alaikum, can you hear me?
Yes, sir. Yes, sir.
Okay. First of all, thank you so much for inviting me to this session. And I'm incredibly proud to know that 10 of the matched candidates for this year from Amiruddin. So it's a proud moment for us. Congratulations to everyone who matched this year. First of all, my introduction, I'm Dr. Ali Nauman, currently working as an attending here in Massachusetts. So I was from one of the pioneer batches of this college. I would like to thank Dr. Fareed and the organizing committee, Ahmed Faraz and Ahmed Farouk, to organize this event and everyone who is involved. It's a proud moment that we are holding this seminar this day after like 5 or 6 years after the inauguration of the college. So thank you everyone for joining today. Okay. So let's talk about the clinical rotations, as Luqman was discussing very important points, electives and observerships. First of all, you need to take all the exams. Then afterwards, think about the rotations, just take your exams while doing med school. And then either you do elective, either you do observership, internship, whatever. It doesn't really matter. You need to secure a letter of recommendation where you are working. Now, how do we get the rotations? First of all, that's a big question. So reach out to your alumni or people who have matched from your college first. See if they can accommodate you in their own hospitals for the rotation. Then probably reach out to me as well. I'm trying to get started rotations this year with me. I'll take some of the students with me this year. I'm trying hard to get Amiruddin students with me so that they can rotate. And then there are few websites that you can do. First is AMA, which is American Medical Organization, FREDA. So when I was in your shoes, I used to apply every day and sending out mass emails to everyone looking for observership opportunity. So I used to email like 200 programs every day. Now, where do you find the list of those programs? You go to the FREDA website and search, for example, gastroenterology. You have like 200 programs coming in, and then you email their coordinator that I'm interested in observership or shadowing, and then they will let you know. That's how I got 3 or 4 rotations back in like 4 or 5 years back. Now, this rule still applies. People don't try it, but this thing still applies. You can reach out to all the programs, gastroenterology, hepatology, either oncology, and try to rotate with them like this. You don't have to ask anyone, just apply by yourself every day, like mass emailing. Now, other than that, you can reach out to your alumni to arrange a rotation for you. LinkedIn is an important network that you can use. And these are things that you can do to apply and get a rotation, or reach out to any people that you know in the US to help you get a rotation. You will need to make a CV and some immunizations and have to do your step 1, step 2, and possibly now ECFMG certified as well, because back in the days, you couldn't get ECFMG certified without getting the CS. Now you can get ECFMG certified without doing the CS, just with the OET. So ECFMG certification is the key to get the rotation these days. Otherwise, you would have to do electives. You can apply, but electives people, they also prefer, people who are ECFMG certified. And then what are you gaining from the rotation? So the major gains from the rotation are you get to know the US healthcare system. You get to go there, see how the documentation is done, how the patient flow goes around, and how the culture is over there. You are not there to just learn medicine. You are there to observe the culture, to connect with people, to know about people, and to find someone who can recommend you in the residency program. For example, when I was in your shoes, I used to find people during my rotation that can recommend me in their programs. I managed to get some interviews through that as well. So at the end of the day, you need a good LOR and build connections wherever you go, so that it may help you getting a residency interview in the future. Now, regarding the finances are involved, you need to have, I mean, some electives are paid, some are non-paid, some are free observerships. So go for something which you don't have to pay. Either it's a clinic or hospital or university. I mean, it doesn't really matter. You need to be in the system to get in there. So I would say these things about the rotations, and be professional on your rotations, and be kind, and ask questions, not a lot of questions. I mean, sometimes people ask a lot of questions that you really undermine their own residents, and people don't feel well when you do that. Okay, so, and then again, reach out to us or the alumni. Be proactive and enthusiastic during your rotation. Don't just visit or spend 4th of July weekends. So any questions? Anyone has questions for me? So how to request a letter of recommendation is, I can see on my screen. So letter of recommendation you can ask is, when you secure a rotation, you go there every week, you ask your feedback by the end of the week to your attending who is supervising you. See, how am I doing? How can I be better? What can I do to improve myself? So these things, they'll see that initially you came in, you are a little weak. Now you're trying to improve and being proactive. So after the 4th week or so, they'll see your progress from the day 1 to day 30th, and they'll be happy to give you a letter of recommendation at that time. Okay. Can we move to the next slide? Yeah. All right. So, any questions from anyone from the audience? And thanks again to Ahmed Faraz and Professor Fareed for organizing this huge event. And we are blessed to have you people around.
Sir, thank you very much.
Okay. Thank you so much. Thank you.